Decrease central line infections by Erica Nicola. Central venous catheters. Central venous catheters are vitally important in treating hospitalized patients. While these catheters often deliver life-saving treatments to infection, blood products, and fluids to critically ill patients, they can also be a pathway for microorganisms to enter and cause infection in the bloodstream. These infections are often referred to as Cvc, central line associated bloodstream infections. Cvc is a primary laboratory confirmed bloodstream infection in a patient with a central line at the time of or within 48 hours prior to the onset of symptoms, and the infection is not related to an infection from another site. In the United States, from 250,000 to 550,000 Cvcs are estimated to occur every year, which results in a rate from 10 to 30% of mortality. On top of this, Cvcs are the costliest of all hospital-acquired infections, each case costing an average of $46,000 per case. For something that the main purpose is to treat patients, it can also create problems. We look at what can be done to decrease these infections that result in increased costs for hospitals, increased hospitalization for patients, and can even lead to mortality. Haddadin suggests that most cases of Cvcs are preventable with proper aseptic techniques, surveillance, and management strategies. When hospital staff are using proper aseptic technique and are required to demonstrate their knowledge, incidence of Cvcs will be decreased. Mission and vision statement. SRHM states that a mission statement is a concise explanation of the organization's reason for existence. It describes the organization's purpose and its overall intention. It also defines a vision statement as something that looks forward and creates a mental image of the ideal state that the organization wishes to achieve. It is inspirational and aspirational and should challenge employees. CCH mission. The mission of CCH is to provide quality patient care in a compassionate and competent manner that leads to positive patient outcomes. Decreasing central line infections decreases hospital stays for patients, decreases hospital costs, and above all, leads to healthier patients. This will happen by increasing education with staff on aseptic technique with return demonstration of aseptic technique and insertion. This will create a safer environment for patients and produce confident staff. CCH vision. The CCH vision statement is, as one of the most progressive small community hospitals in the state, CCH seeks to uphold its value of patients, community, and staff by decreasing central line associated bloodstream infections. SWOT analysis. SWOT analysis is a commonly used method for analyzing and positioning an organization's resources and environment in 4 regions: strengths, weaknesses, opportunities, and threats. SWOT analysis allows an organization to hone in on its strengths and cautiously work on its weaknesses. SWOT analysis allows an organization to identify opportunities and note controllable weaknesses within the organization. A SWOT analysis will be completed on CCH to identify the factors discussed. Strengths. CCH strengths include high value of employees. They are willing to devote funds to education for employees and have many skilled and certified staff. CCH is a level 2 trauma center and is part of St. Joseph Mercy and the University of Michigan. CCH has an easy and up-to-date charting system, and the hospital is centrally located. Weaknesses. CCH weaknesses are high turnover rate for staff. They are often short-staffed, and jobs are physically and mentally difficult, and central line infection rates are increased. Opportunities. Opportunities at CCH include educational opportunities for staff, lots of employment opportunity. They are community advocates, and they have tuition reimbursement. Threats. Threats include employee burnout, low security, and competition from other hospitals. Aim statement. An aim statement is a clear, explicit summary of what your team hopes to achieve over a specific amount of time, including the magnitude of change you will achieve. The aim statement guides your work by establishing what success looks like. The aim statement for CCH is to decrease central line associated bloodstream infections by 80% within 1 year. This will occur by increasing education and return demonstration by employees who will perform insertion. Staff will be educated on signs and symptoms of infection, as well as proper aseptic technique. Decreasing these infections will benefit patients, hospital, and staff. Stakeholder engagement. Stakeholders are generally anyone who has a vested interest in the organization. For CCH, its stakeholders include patients, physicians, employees, and the community. Different structures will be used to engage different stakeholders. For patients and the community, statistics on decreased CLABSI rates and how CCH has provided staff with increased education will ensure patients that they are in competent hands and encourage members of the community to use CCH for their healthcare needs. These statistics will also make employees and potential employees feel that they are valued by working for a company who provides its staff with proper and current education. This will also encourage physicians to have trust in their staff and feel that their patients are being cared for by knowledgeable members. To empower stakeholders, a satisfaction survey would be dispersed. This will give CCH an opportunity to visualize what they're doing right and what can be improved on. This will empower its stakeholders because they will feel that their voices are being heard and that they matter. Wrap up. There are many factors that go into a performance improvement project. Identifying the problem in the organization and using that to create a mission and vision statement is a starting point for any organization looking to serve its stakeholders. A SWOT analysis also contributes to performance improvement by clearly stating that the organization's strengths, weaknesses, opportunities, and threats. This allows the organization to understand what they are doing right and what needs to be improved on. Next, an aim statement is conducted to specifically state intentions of improvement, who this will benefit, and when and how this will be completed. Finally, empowering its stakeholders may be the most important factor of all. Ensuring that all those who hold a vested interest in the organization understand that they are making strides towards improvement makes stakeholders feel valued and heard. Decreasing central line associated bloodstream infections at CCH will do nothing but benefit all stakeholders. CCH can expect a decrease in patient mortality, increased patient satisfaction. Employers who take time and funds to educate staff appropriately leads to staff who feel valued and appreciated. It is important for organizations to use these important improvement factors when conducting any quality improvement project. This ensures that no shortcuts are made and that everyone is appropriately addressed. References. Thank you.